Dr. Khadi, let me start with you. So lately we have been seeing and hearing a lot that people are talking about mental health issues, psychiatric issues, and these incidents are coming to light more frequently, partly because of media, social media. So I want to hear from you how serious the problem is, and is the attention is getting right now. It deserves that attention, and what's the reason for the rapid rise in mental health crisis?
So there's a two-part question. So the first was the seriousness, and then what's the cause of. Yes, it is a serious problem because we are seeing so many suicides in our community in general, not just the community overall. There's a lot of reasons to that. That there's a rise in depression, rise in anxiety, stress level. We're seeing that in our clinic too. And it's such a shortage. There's such a huge demand for psychiatrists. We don't have enough psychiatrists or therapists. Like for example, somebody told me in Wyoming, state of Wyoming, we only have like 5 psychiatrists, the whole state. So there's a whole shortage of mental illness providers. So why is this happening? Multiple reasons. I mean, one is that there is people are coming to get help, so that's that one reason. I think they're seeing that we're seeing people saying, okay, we need help, and also the whole the thing of in the past where people were interacting with each other. There was that normalcy that was there, but now we're seeing it's more on the internet, and there's that disconnect with people that's there. So they're looking for somebody to talk to, and we don't have that personal touch. So, and I think that's also that one of the causes. There's multiple causes, but that's one of them. And I think as people are getting aware, they're coming for help. And the other thing is that we're seeing mental illness from as small as ages 3, 4, 5-year-olds, 6-year-olds. We're seeing that.
Yeah,
So
that's very shocking.
yeah, it's that age group. We were seeing people talking about, like, I'm a child psychiatrist, so I see kids and they talk about depression and suicide to me when I see them at that age, and you wonder where is that coming from? So it's that it's that day and age. We are about society. We are about the click society. We want things instantly, and because of that frustration level it's as increasing for all of us. We want everything now and then. So that frustration demand doesn't mean we want that instant help. We don't have that. The frustration builds up, and that leads to your anxieties and depression, and then there's nothing, and there's nobody to talk to. They don't have that. So where do they go? So multiple reasons. I think that's kind of I see it in my clinic and my practice, what is going on.
Right. So it's more the modernization, the times have changed, and multiple factors that leading to this rapid rise in mental health crisis. Let me switch to Imam Azhar. Uh, I'm curious to know what Islam has a take on mental health crisis, or did it existed during the time of Prophet or during the early Muslims, or is it like a new innovation of the modern society, or it's a new problem that we're facing?
I would say it's a combination of both. And I want you to understand that when you take something apart and try to define it in separate segments, you over time lose the concept of a holistic view and holistic picture. So, for example, back in the days when we were kids, you buy Legos, it would come in a box of 1,000 pieces, 1,500 pieces, and then you use your creativity to build what you want. Now, what's happened is that you get these pre-made boxes that these pieces will build a car or they'll build a castle. And what the kids are losing today is the understanding that they could build other things also. So if you understand this example, let's put it into perspective with Islam. Many people ask that question, does Islam even address mental health? Islam addressed holistic existence that incorporated a person's mental wellness, physical wellness, and also spiritual wellness. What we've done is that we've fragmented these. And we fragmented in a way that you either find Muslims today who are social media talking about taking care of the body using the hadith and saying you have to be buff and strong and go to the gym, right? But that then is indirectly denouncing the need of mental health.
Exactly.
And people who are in that physical wellness state end up committing suicide because they have separated physical wellness from their mental wellness. And those who are focusing on mental wellness, saying that this is something that no one's talking about, are denouncing physical and spiritual wellness. So in our Islam and our Quran, there are numerous examples. And in all these examples, and I don't want to go through all of them piece by piece, but there was a year of sorrows for the Prophet Sallallahu Alaihi Wasallam. There was Yusuf alayhi salam being segmented or segregated from society, called out for being what he wasn't. He was accused, and thus he was imprisoned. That's also a mental issue that Allah is talking in the Quran. Nuh alayhi salam with his son, Lut alayhi salam with his wife, Musa alayhi salam running from the Pharaoh. All these scenarios talk about a mental health component to their overall situation. And if you look at how the Quran addresses these stories and how they were able to get through, it was always in the company of people. So, for example, Musa alayhi salam is running to a town. He doesn't even know who's in that town. He doesn't know anyone in the town. He helps two women. Their father says, "Bring him to me. He should be our guest." And long story short, he marries into the family. He works for the family. He then becomes the prophet and moves on. But what did he say to him? That you're with me, we'll take care of you. Like, we'll get you away from the hands of the evil people. The point is this: a person who's feeling mentally vulnerable or susceptible to depression and anxiety and suicidal thoughts must resort to assistance from people. They need people. We need people to be with us at that moment. And that's why the concept of ummah, the overarching theme, not only covers mental health, it protects one's mental health beyond their physical and spiritual health.
So the lack of human touch, the lack of, I would say, coming together as a group, as a community, that's playing a role.